Class of 2026, Department of Dentistry. Class of 2027, Department of Medicine. Esteemed Rector, members of the Senate and Executive Council, distinguished guests, colleagues, family members, and friends. As Dean of the School of Medicine, I am pleased to formally welcome you all to the Fall 2021 School of Medicine New Student Orientation Program. Understanding the anxiety related to applying and getting into a competitive program of dentistry and medicine like ours, I would like to start off by congratulating each and every one of you on your acceptance to our school. Out of hundreds of applicants, you have been selected and recruited to study medicine and dentistry at European University, Cyprus. Your class represents 28 different countries. Your class is made of individuals who have incredible experiences and who will bring amazing perspectives with them. Each of you brings something very special to our school and to our university. Now, each of you will come together to make a new beginning, your beginning, at our innovative and dynamic university. Today is a pivotal milestone in your lives. Today is the first gathering of the first class of medicine and dentistry. Going back to its roots in cartography, orientation, in its most literal sense, means using a compass to determine your bearings and your direction. When you are properly oriented, you're not only ascertaining your position, but you're able to move forward and find your way. In other words, with orientation, you're able to answer that important question of, where am I now and where am I going? Over the next few days, our orientation program is designed to help you answer these questions. But our orientation program will do something else for you as well. Today, in your student orientation, you'll experience a major shift in your own personal compass. The needle of your compass will move across the meridian from you to we. This is what happens at matriculation. In the process of orientation, you'll experience this subtle but very important categorical shift from being independent to becoming a part of the EUC team, the EUC family. From now on, we're in this together. We promise to do everything possible to give you everything you need to become an outstanding physician or an outstanding dentist. The school's priority is to provide each and every one of you with the formal training and qualifications you need to practice medicine and dentistry. Central to our every effort is to put you, the EUC student, first. You're commencing on your medical and dental studies in a very special year. This year is unique as the COVID pandemic has allowed us to discover new ways to learn and new ways to support each other. We have gained this experience and now we're doing it very effectively. However, this year is also special because our medical program, only after completing 3 cycles, is stronger than ever. We start a new academic year with full accreditation from the World Federation of Medical Education and a departmental accreditation from the Cypriot Agency of Higher Education. This year is also special because the premier educational program of our Department of Dentistry remains the first and only dental surgery program in the nation. The dental clinic is now operating at full capacity, offering dental services to the community. There are so many exciting and fulfilling initiatives taking place as we move forward to achieve excellence in our mission of education, patient care, and research, as well as service to the community. As Dean of the School of Medicine, I can say with complete conviction that what makes our school exceptional are the faculty and staff who have shown an unrelenting dedication to you, our aspiring students, and their goal of guiding you to become compassionate, highly skilled healthcare providers of tomorrow. EUC School of Medicine, by virtue of its vision, is on a path of greatness through service. We are proud to welcome you on this shared path. In closing, I want to extend my warmest welcome to each and every one of you, our new class of medicine, our new class of dentistry. At this pivotal moment, you are now a deeply valued member of the EUC family. Welcome.
Hello everybody, it's my great pleasure as the Executive Dean and Professor of Orthodontics of the Department of Dentistry, European University of Cyprus, to welcome all our new students to this orientation day. As you know, our 5-year program taught in English is internationally recognized and follows the guidelines of the European and North American dental education standards. It is the first and only dentistry program in Cyprus, and the graduates of our program are qualified to practice dentistry without exams in all European Union countries and the countries of the European Free Trade Association. It's very important to recognize that until now, 28 nationalities have been represented in the student body of our program. It is important to recognize that our university belongs to the Galileo Global Education Group, a very big, prominent and internationally recognized higher education consortium that has universities all over the world. However, in addition to that, during the last month, the European University of Cyprus has become a member of the Utrecht Network, a network of 31 of the most high status and historic universities in Europe from 26 countries, and should be noted that among them we have many universities that belong to the highest 100 best universities in the world. As you know, a dentist, the subject you have decided to study, is a person who deals with the prevention, diagnosis and treatment of diseases, injuries and malformations of the teeth, jaws and mouth, and also who has the responsibility and skills to replace missing dental osseous and soft tissues in order to restore function and aesthetics. Why someone decides to study dentistry and why someone decides to become a dental practitioner? First of all, because dentists restore oral health and transform the lives of their patients. In addition, by providing preventive care, delivering dental restorative procedures, eliminate pain, or improving dentofacial aesthetics, the dentist can also experience the satisfaction of positively transforming a patient's life by restoring oral health. It is important to recognize that contrary to other professions, dentists can have independent careers. Dentists have the opportunity to own their own business right after dental school, and this is the reason our program aims to provide strong qualifications and skills for succeeding in this kind of task. The income of dentists is well above the national norms in most of the countries, and of course, a dentist can choose a number of career options, full-time or part-time, in private practice, in the public sector, in academia, research, etc. It's very, very important to see that in the US New and World Report during the last year, constantly the dentists are listed among the top jobs in the number of 100. And of course, in order to become a successful dentist, you have to develop skills and competence. And it's very important this competence to be acquired during the 5-year education, especially during the years of preclinical and clinical practice. These skills should include biomedical knowledge, surgical dexterity, critical thinking, analytical skills, professionalism, management skills, and communication. Our program satisfies the competence requirements for the practice of dentistry in the European Union, as it has been described by the Council of European Dentists, and also updates its curriculum according to the profile of undergraduate dental education in Europe, as described by the Association of Dental Education in Europe. Of course, we need to have students who are fully committed to these studies. Our students, in order to become successful in their studies and in order to become good dentists when they graduate, they must be dedicated, they show commitment, they work hard, they have to be ethical, they have to be professionals, and also punctual and team approach regarding their participation and work in the classes, labs, and in general the university. Our university provides excellent facilities and curriculum with regard to the first year and a half as far as medical labs, Also provides excellent skills and simulation dental labs during the remaining year and a half in order to provide excellent preparation before the patients are treated by our dentists in our clinic. Our students are trained and educated by internationally qualified faculty covering all the different subjects and disciplines of dentistry, including also dental specialties work at the undergraduate level. Your cohort, your batch is going to be extremely lucky because in the time you are going to enter the clinic after 3 years, you will be able to use the new facilities that the leadership of the university has decided already to start building next to our existing facilities. When I finish, I like to say once more welcome.
Thank you. Thank you for the honor. Thank you for the invitation, and I would like, to welcome our new students. I would like to carry on from where the dean left it, and the dean was very emotional, and I think I will become a little bit emotional because it reminds me my first day in the School of Medicine. When I was looking at the internet to try and find what motto I should use for a welcoming ceremony, for a welcome message from a chairperson, I found a quote from one of your colleagues from another university who actually said when welcoming junior students, welcome to medicine, welcome to the rest of your life. And it takes a while to understand that once you are in medicine, you are always in medicine. Once you are in dentistry, you are always in dentistry. This is a journey that never ends. And it's a long journey, and I know that you have done a very long journey. And for this, we welcome you, and we congratulate with you, not only with you, but also with everybody who was there to celebrate your achievements. But we also know that you had a very long road in order to get here and be accepted into a very competitive program of medicine in the European University Cyprus. We understand your fears, we sympathize with your emotions. But on Friday, you and your beloved ones, you are going to celebrate the white coat ceremony. And you will, the moment you wear your white coat, you will be a different person. You will stop being a student and you will start becoming a doctor. And of course, welcome to the rest of your life. It's okay to be afraid. I was afraid when I was in your situation, when I was a first-year medical student. I was thinking, will I be competent? Will I remember all of that? You may even feel that you may not be ready for medicine. I felt it. 90% of the medical students feel it. It is okay to feel it like that. You may even wonder, and I still remember when I was looking at the huge anatomy books, how will I ever be able to remember and recollect all this information? But I'm here to be honest with you. Medicine is demanding. You will need to study hard. Lots and lots of hours, lots of coffees to keep you awake. The expectations of the Faculty of Medicine are extremely high, and you have to work in order to achieve our high expectations. And I know that you may be a little bit jealous from all the people who have not chosen to study medicine, who live a better life than you do. But on the other hand, I'm here to tell you that everything is going to be okay at the end. First of all, as I have told you before, I have felt it. All medical students have felt the fear. All medical students have felt the uncertainty. And sometimes, my dear colleagues, it is fairly okay if you don't feel okay. But you need to remember one thing. In medicine, you are never alone. There is always a support team behind you to help you and support you. For the university, it's us. For the rest of your lives, it's going to be your colleagues. So in medicine, you are never really alone. And as the dean said very elegantly before, in reality, medicine is a team. In medicine, we practice everything in teams. So you are never alone, and you should never hesitate to reach out for help. Your achievement today is important, but it's just one small piece that will make you a complete doctor. The graduation will be the second piece. The acquisition of your residency will be the third piece. And there will be a fourth piece in the puzzle for those of you who decide to do and follow academic careers. But remember, guys, this is the first step in order for you to be able to join greatness. And you cannot fail. You cannot fail to join greatness for a very simple reason, because medicine has been created by giants. And even now, in the era of the COVID, we have learned so many things about medicine that we did not know before. So you are going to be the generation of doctors who will be exposed to even more information than before. And we will be here. We will be here from the beginning. We will be here to witness the journey with you. In this slide, you see the major achievements of 2019 in medicine. I hope that in 6 years' time, we will have a slide celebrating your achievements as you graduate the School of Medicine. And finally, I would like to say that the European University Cyprus, along with the School of Medicine, extends their hands and they offer their hug and they welcome you to something that you will hear me explain a little bit more in detail later, called the community of practice. Remember that you now belong to a new family. You belong to the family of medical doctors. And in this community of practice, we have several common features. We speak the same language, we have the same emotions, we think the same. We are different, but we are alike. So I would like to welcome our new students to the School of Medicine. Thank you.
Dear students, I would like to congratulate you on your achievement in being selected as dental students. You have chosen a unique and demanding profession, a profession where you have to put the interests of your patients before your own, a profession that has to do with trust, the trust of your patients. I wish you good luck in an exciting profession. Thank you very much.
Welcome, new students. My name is Maria, and I would like to welcome you, all of you, to the European University Cyprus and to the Department of Enrollment, the largest department of the university. Here is my colleague, Mr. Iraklis Chrysanthou. He is going to be your student advisor in the Department of Dentistry. I will be your student advisor in the Department of Medicine.
Hello, my name is Iraklis Chrysanthou, and I will be your student advisor for the dentistry students. Welcome.
Our department, the Department of Enrollment, is consisted of 5 main offices: the Office of the Registrar, the Student Relationship Center, the Planning and Reporting Center, the Financial Aid Office, and the Advising Center. Each student is assigned to his and her personal student advisors. Advisors are basically your key connection to your registration, add and drop process, and any other issues related to the policies and regulations of the university. We are assigned to you from day one until your graduation. Now let's discuss some useful information. All students are required to follow specific rules and regulations of the university. You can find these at our website. Holidays are very, very important for all of us, so please check up our academic calendar. Furthermore, you're requested to have your student ID card. It will give you the access to specific services around the campus, such as the library and the computing center. Get advantage of student discounts by just showing your ID card. For example, students pay half price for all public transportation. From now and all students will have a university email account. Use this email account to communicate us. Another important tool is my EUC Login. It's the portal that will bring you in front of useful tools throughout your studies, such as the Blackboard, the webmail, the library, and the Moodle. We are always here to assist you, no matter what. No need to book an appointment with us. Our door is open for you anytime. You can always track us down on the below emails and on the phone number, 22-713-000. I would like to welcome you once again, wish you the best, and we will be here for you no matter what. Thank you. I will now call my colleague, Mrs. Christina Colazzi. She's the international officer, and she's going to provide you information regarding the travel and the visa process. Thank you.
Hello, everyone. Welcome to EUC, the International Student Advisor. My role is to help you with your traveling and visa issues and formalities. And since traveling has become a bit of a difficult task for many of you, and the government has set a lot of rules and protocols, we need to make sure that you follow everything in order for you to have a safe and easy travel to Cyprus. If you're an EU student that belongs to category B, actually you have to register for the Cyprus Flight Pass portal, check your country's category, and if you belong to category B, then you just need to take a COVID test 72 hours before your arrival. You travel and welcome to Cyprus. However, if your country belongs to category C, then you need to contact me at this email, c.colazzi@euc.ac.cy, so I can send you a special letter and you will receive your special permission to travel with this letter. Then you need to book your ticket and get your flight pass 24 hours before departure. If you do belong to a country from category C, then you do need to self-isolate for 14 days before you can come to campus or go anywhere in Cyprus, according to government regulations, of course. If you're a non-EU student, then you must ensure that your entry permit or blue visa is issued before you decide to travel. That's if you decide to travel. Again, you have to register on the Cyprus Flight Pass portal, check your country's category, and if your country belongs to category B, then you just need to take the COVID test. And of course, come to Cyprus with your blue visa. If your country belongs to category C, then you have to upload your blue visa on the special permissions section of the Cyprus Flight Pass, then book your ticket once you obtain your special permission, and apply for your flight pass 24 hours before departure. Again, you have to self-isolate for 14 days upon arrival. Please ensure that you have your accommodation arranged before your arrival, especially if you belong to category C, since you will not have a place to self-isolate if you don't. This is what Cyprus Flight Pass portal looks like. You can check the country categories in there, and you have to register so you can log in with your personal details. Now, after arrival, all students, EU and non-EU, need to register with the Republic of Cyprus authorities. The EU students, they apply for what they call a yellow slip, and they have to apply individually. We help you through this process. We guide you what documents you need to submit. And non-EU students, they have to apply for the student residence permit, what we call a pink card, and they have to do it through the university. Again, we will guide you through this process, so have no worries about anything. Do connect with us, especially me, before you're coming, especially if you're from category C, you need any advice you may get. So use these emails and phone numbers to get in touch with me before you book any tickets. I hope to see you on campus soon. Welcome to EUC, and have a great academic year.
Hello, I'm Dr. Nikos Karpetas. I'm a cardiologist and I'm a lecturer here at the EUC. And I'm about to talk to you about student health services and vaccination requirements for your clinical training. Before that, let me welcome you to medical school and to medical students life, which, as you know, as the soundtrack of this famous movie says, it will be the time of your life. This is an electrocardiogram and an ECG, and it's a very important diagnostic tool in cardiology. I know you don't know the diagnosis. I just want to show you because it has many similarities with students' life, medical students' life. As you know, there are a lot of ups and downs. Let's say now you're here, you are at a peak because you are in a lot of stress, it's something new, just about to start your medical school. In a few days, in a few weeks, you already feel better, but later there will be again some stress because of the midterm exams. Later you have your Christmas vacation, no stress. Then it will be a small up again, a small peak. We will be coming back and having to study for your exams. Then you have a big peak, final exams, another peak, learning the grades maybe. Next semester, again, some stress for the midterm examination, final examinations, and before you know it, the first year is over. You have no stress because it's summertime. Please try to enjoy these ups and downs because later there will be a resident doctor's life, which is more or less like this. Or like this. The important thing I want to say is that as in the ECG, as the electrocardiogram, a life with no ups and downs has no meaning. There is no life without ups and downs. As in cardiology, when you have a malignant and deadly arrhythmia, there comes an electroshock, saves your life and brings everything back to normal. This should be the case in your student's life. Instead of an ICD shock, you have to have a good friend, beloved ones, your family, and vacation to bring you back to normal. So, student health services are open from 8 a.m. to 9 at the night. For minor injuries, for maybe you catch a cold, mosquito bites, simple things when you have a headache from studying, or when the night was too long. It's located in the EUC campus. You can go this way, turn right through this glass door. You'll find the hallway, then turn left, and you can find our health services, which actually look like this. So it's a basic office for simple treatment. If there is something severe, of course, you will be transferred to a hospital. So, of course, the wickets are closed. You can come in contact with Theodor Hagiorgiou or Mira Georgiou under these telephone numbers or via email. And regarding the vaccination requirements for your clinical training, please take care of them as soon as possible. Don't wait until year 4, okay? You can go up in the 3rd floor, and you should remember 2 important people for your documentation. It's Haralambos and Urania. All right, important people. You should sign this confidentiality undertaking report, and the minimum requirements for according to the Cyprus Ministry of Health are: you have to have a valid health insurance. If you're covered by the general healthcare system here in Cyprus, it's enough. Otherwise, you have to have a valid health insurance. Be careful. If you have a health insurance in your country, make sure that it covers you also in Cyprus. You have to bring evidence of the MMR vaccination, which is measles, mumps, rubella. You have to have either evidence or adequate immunization against hepatitis B. You have to show us evidence of the DTP vaccination for diphtheria, pertussis, and tetanus. And you have to show us results, negative results, of tuberculosis, either with a skin test with the famous Mandu test, or even better with interferon test from the previous year. So overall, 6 documents needed: confidentiality form signed, and the 5 health insurance and vaccination requirements. Welcome to EUC School of Medicine.
Welcome one more time. This time I'm going to present the standards of academic and professional conduct for both the departments of medicine and dentistry. First of all, you need to understand that I will be referring to everybody as doctor because dentists are oral physicians and the mouth is not separated from the rest of the body. So the same standards that apply for medical doctors also apply for dentists. So the first question that one should ask is, what is a good doctor and how do we make one? And let's make a story. Let's suppose that you've got a Aladdin's lamp and as we found it, you only have one wish. And this wish is that you need to go and make the best doctors there are in the world. What would the genie create? This is a very difficult answer, but in reality, the genie has to go back into the medical schools and make sure that two important pylons, which are the professional qualities and the academic contact of the students, are maintained throughout their studies. So, let's start discussing about the professional qualities that each healthcare professional should possess, not only in the School of Medicine, but throughout his medical career. And the first and foremost quality is that of respect. Confucius said that you need to respect yourselves and others will respect you. In medicine, we say something similar. We need to respect people, whether they are healthy, whether they are ill, and we should not make any discriminations. We should respect all people regardless of who they are. We need to support our patients, and not only our patients, but also their families, also their loved ones, because the definition of family is changing in the 21st century. And we need to provide that support whenever the patient or the loved ones of the patient need it most. An important professional attribute of every healthcare professional is that they need to promote and to treat. They need to be proactive in both verbs. So they need to promote health and they need to treat disease. One should not take priority over the other. These are duties that carry equal burden for every healthcare professional. Of course, if you've got a very sick patient, the first thing that you need to do is that you need to treat the patient. But when you don't get to treat any sick patient, it is equally imperative and important that you promote a healthy way of life. Guys, we're living in the 21st century, and whether we like it or not, technology plays a major part in our life. And technology can be used to our advantage. And as a result, we need to embrace technology. We need to embrace the power that it gives us. But this does not mean that we forget that the center of our care remains the patient. And as a result, we need to use the technology in such a way that we provide the best available information to the patient. Finally, we need to remember that no matter what the information and the technology is telling us, we need to respect the individual values and preferences of each of our patients. An important professional attribute of every doctor, dentist, nurse, I can't think of a profession that should not have this quality, is that you need to be an active listener. Already we know that active listening is not I just listen to what the other person is saying, but in reality, I ask questions and I listen to them carefully in such a way that I am able to paraphrase what they've said and convey
the same meaning they want to convey to us. A few years ago, we realized that the center of healthcare should not be the healthcare provider. It should be the patient. And the patient is a stakeholder in the treatment of his disease. And as a result, now we know that one of the most important professional qualities of every healthcare professional is the patient-centered care. There's a pyramid for patient-centered care, and you will be exposed to this pyramid throughout your studies, because the patient-centered care is a core value of the professionalism you need to exhibit as doctors or dentists. So, in order to provide patient-centered care, we need to give unbiased advice. And we need to assess each situation carefully and help whatever the situation might be by respecting the wishes of our patient. But in medicine and dentistry, you are not alone. Medicine and dentistry is a team sport. And as a result, you need to work in an effective manner with other members of the healthcare team, whether they are doctors, dentists, nurses, occupational therapists, physiotherapists. The center of our care is the patient, and we are the team who is taking care of the patient. So learn to communicate effectively with other members of the team. You also need to be proactive. And by being proactive, I mean that you need to be the advocate for your patient. You need to be the voice of the patient in any situation. But on the other hand, you need to be a mentor to people who are junior and they need to learn from you. On the other hand, you need to be able to be a mentor for other members of the healthcare professional team. And you need to understand that you don't know it all. And as a result, you need to be ready to learn from others, irrespective of their age, role, or status. No one knows it all. And that's why we need to work together and we need to pay attention to each other. The second pillar that the genie should go and work upon is the academic contact. And well, we use the word academic contact, but in reality, it is not only academic contact. These are qualities that you need to carry in the university, but also in your professional lives after the university. So the pillars of the academic contact, first of all, is honesty. No one likes a liar. And if a doctor lies, that's one of the most serious offenses. And as a result, what we expect you to do in the School of Medicine of European University, Cyprus, is that we want you to maintain the highest standards of academic honesty. You need to record all data from your patient into the patient chart in such a way that they are accurate and pertinent to the care of the patient. You also need to understand that when you are conducting research, because research in reality is what guides medicine and dentistry in the years to come, you need to conduct it in the most unbiased manner. And you need to report the results truthfully. Do not falsify. Do not play around with numbers so as to get the results you want. This is a serious academic offense. And you need to remember that reporting falsified data can lead to serious disciplinary actions. And finally, when I understand, the time that I understand that people have reached the point where they are ready to be honest is when they can admit to the errors. They can say, I am sorry, I haven't done it properly. The moment you admit to your errors, this is exactly the moment where you know your barriers. This is pillar number one of the academic conduct, but it is not the only one. The other important pillar is that of confidentiality. Confidentiality is not only an academic attribute, it is also a professional attribute. We cannot go around and discuss what our patients have with people who are not directly involved with the patient's care. And even when we do that, even in the busy corridors of a hospital, we need to do it in a place where other people will not be able to listen to what we are saying. Remember that the patient is a very sensitive being and his illness is also very sensitive. So these are sensitive data. The other, which is part of confidentiality, but in reality, it's not only confidentiality, is the fact that the patient has dignity. The patient has the right to maintain his dignity even at the moment of his death, especially at the moment of his death. Another pillar, extremely important, is that of responsibility. And you will see that the bulk of obligations of academic conduct fall within the pillar of responsibility. And the first pillar of responsibility is that you need to set patient care as the highest priority in the clinical setting. There is no other priority. Yes, you are there to learn, but not at the patient's expense. So the patient needs to be your first priority, no matter where you are, whether you are undergraduate students, postgraduate students, residents, or even consultant or attending physicians. You also need to recognize your limitations and you need to ask for help. It's not bad. It is mandatory to ask for help. As medical students, you will be rarely unsupervised. But there might be times where other healthcare professionals who will be looking over you might be busy. So if you cannot do something, seek help of a senior. Never exploit any type of relationship with your patient or their families for any purpose, either sexual, emotional, financial, or even educational. In the student behavior, both language and appearance, we expect you to be professional, not only in the healthcare setting, but also in the classroom. This means that we will not allow someone coming into classroom with an inappropriate dressing. Do not use alcohol or drugs in any way that could interfere with your academic, professional, and clinical responsibilities. This is a serious offense, and it is your responsibility. And despite the fact that this is not part of the actual responsibilities set by the GMC, I will add another thing here. Please note that your social behavior, especially in the COVID pandemic, needs to be restricted. You are the mirrors of the healthcare system. Never impugn the reputation of any member of the healthcare team, irrespective of who they are. We don't care if you don't like someone. You cannot go around saying lies about him. However, if you detect any unprofessional behavior, you need to report it to the Faculty of Medicine or Dentistry, respectively. Never misuse property and resources that belong to the university. The university has the resources for you. They are yours to use, but do not misuse them. Don't take away computers, phones, or other resources, because those resources will be needed by a classmate of yours, and they will not be available. You need to inform the people who are assigned to you when you cannot fulfill any responsibility, no matter whether this responsibility is an essay or an IV catheter, or the insertion of a nasogastric tube, or a tooth extraction. You should inform the person who has assigned that if you are unable to do it, or if you've got any problems in doing it. And one of the most important things that you will understand as healthcare professional, how important this is that you need to arrive on time. I know that we're going through challenging times, and we will not be seeing you face to face for a few months. But even if the classes are conducted online, this does not mean that you can log in anytime you like. Punctuality is a key attribute of any healthcare professional. And also remember that you need to take responsibility for your work. But on the other hand, you have expectations, and the genie had to work on that. What do you expect from us? Not only from faculty, but also from residents, fellows, attending, or consultant physicians. You have the right to expect clear guidelines on what you are expected to do, whether these are assignments, whether this is test, and you have the right to demand academic honesty from us. You have the right to expect frequent and constructive feedback from faculty and supervisors. And please rest assured that despite the fact that we will be away for this semester, we will always be available to you, ask any questions, and to support you through your journey. And whenever you are participating in any type of research conducted by a member of the faculty, a resident, or a fellow, you have the right to be contributed appropriately and be represented and acknowledged in the paper which will be produced. And finally, I would like to point out that with all these things, no genie in reality can create the perfect doctor. The perfect doctor is created not through magic, but through hard work, through choices and persistence. And in the School of Medicine, you will learn that your choices matter, that we will expect you to work hard, we will expect you to be persistent, but we will be there to celebrate your achievements. Thank you.
Welcome to European University Cyprus, and welcome to the School of Medicine. I'm Professor Elizabeth Johnson, and I'm the very proud dean of our school and its two great departments, the Department of Medicine and the Department of Dentistry. In place of our usual meet and greet in our typical orientation program, during the session you'll have the opportunity to meet your faculty and staff virtually as they welcome you. Our aim is to ensure that we will get through these unprecedented times together. Yes, we're still experiencing extraordinary times, times that the world has never experienced before. But I'm confident that as you meet your faculty and staff, you will see that we will be able to come together as a community and learn. We are in this together, and we stay together. We become a team. We are now your EUC family. Class of 2027, School of Medicine, Class of 2026, School of Dentistry, I proudly introduce your faculty and staff. Welcome.
Dear students, welcome to your new home for the next 6 years. I am Professor Ioannis Patrikios, Deputy Dean of the School of Medicine. I would like to welcome and congratulate each and every one of you for being here today. Welcome to the journey of your life. In the next coming years, you will be learning some of the most profound knowledge the human race has been able to discover and contribute to an ever-evolving field dedicated to helping humanity. You should be very proud of yourself and excited for the future. I wish you a very fruitful semester. Well done and all the best.
Hi. First of all, let me welcome you to the School of Medicine of the European University Cyprus. My name is Theodoros Xanthos. I am the Professor of Physiology and Pathophysiology, and I'm also the Chair of the department. I'm a cardiologist by training, but I have dedicated my life in translational research. Together, and along with other members of the faculty, we're going to embark on the magnificent journey that leads to a medical degree. Thank you.
Welcome to the Department of Medicine. My name is Dr. Panagiotis Ikonomidis, and I teach endocrinology and more specifically diseases of the thyroid gland. I'm looking forward to working with you during your clinical years, learning internal medicine and endocrinology. My main clinical and research interest is the evaluation of the thyroid gland and endocrine neck. I wish you a very fruitful and successful semester.
Dear students, welcome to the Department of Medicine. I'm Dr. Dimitris Dourakis, the Vice Chair of the department and also the Chairperson of Surgery. During the next years, I will be teaching you the courses of Clinical Skills and General Surgery. I'm looking forward to working with you, and I would like to welcome you, wish you a great beginning and a fruitful and productive semester.
Hello and welcome to our School of Medicine, European University Cyprus. I'm Konstantinos Tsioudis and I am Assistant Professor of Internal Medicine. I mainly teach clinical courses from year 4 onwards. Together, we will work to combine your acquired knowledge with developing skills in order to prepare you to enter your clinical placements at the different healthcare settings that collaborate with our school. I am looking forward to meeting you.
Good afternoon to everyone. Let me take the time to welcome you on my behalf at EUC. My name is Dr. Konstantinos Ekmetzoglou. I'm a consultant gastroenterologist and I'm a lecturer here at EUC. I'm a lecturer of gastroenterology and emergency medicine. I wish we could meet under different circumstances, but unfortunately we have to deal with this reality from now on, at least for this semester. Together we'll be doing a lot of courses. I'm the course coordinator for semiology, which is taught in third-year medical students, where we will interpret signs and symptoms, and we'll try to make a possible differential diagnosis for all patients. I'm also the course coordinator of clinical training too regarding the digestive and hematology tract, which is taught in fourth-year clinical medical students. And last but not least, I'm the course coordinator of clinical training 12 for emergency medicine, toxicology, oncology and palliative care, which is taught in our 6-year medical students. Again, I would like to welcome you. Hopefully we can meet in person, and I wish you all a very fruitful semester. Thank you so much.
Welcome to the Department of Medicine. I am Dr. Konstantinos Michailidis. I am a pathologist and I teach histology and embryology. I am really looking forward to work with each and every one of you in histology and embryology. You will be seeing a lot of me on your second and third semester. There will be a lot of labs, of course, during that time, a lot of microscope. So I hope everybody likes that. And I wish you a very fruitful and very productive first and second semester.
Hello, I'm Dr. Damatos Michaelinos. I'm a general surgeon, I teach anatomy, and I want to welcome you in your studies in the School of Medicine.
Dear students, I'm Dr. Aris Angouritis and I'm a lecturer in internal medicine and pathophysiology. I am the coordinator in the first aid course, as well as in the internal medicine course at the final year of your studies. Wish you all the best and a fruitful semester.
Dear all, my name is Nikos Zamboglou. I am responsible for your education in oncology, and I wish you all the best and a good success for your career. Thank you very much.
Hello everyone, welcome to the European University Cyprus family. My name is Andreas Giallouris. I am a lecturer in medical biochemistry and applied dental biochemistry, and I would like to wish you all the best for your new big step. See you soon.
Dear students, welcome to the Meet the Faculty and Staff orientation session. Let me introduce myself. I am Professor Anastasis Stefanou, full-time faculty member in the Department of Medicine. I teach on the cell biology and genetics course modules during the first 2 semesters. I wish you all an enjoyable and successful semester.
Dear medical students of the European University of Cyprus, welcome to our school. My name is Zoe Dorothea Paná. I'm a specialist in pediatrics, so I'm a lecturer teaching pediatrics. Simultaneously, I'm specialized in epidemiology, infection control and prevention at the Johns Hopkins Hospital in Baltimore, United States. I would like to wish you a fruitful and nice and joyful journey at the EUC. We are here to support you in any way. Welcome.
Welcome to EUC. I'm Pani. I'm Sophie. And I'm Theodora. We are the lab technicians. We can't wait to see you at the labs.
Hi, my name is Maria Harlambide. I am the administrative assistant of the school. Welcome to our family. See you soon.
Welcome to the family of the School of Medicine. My name is Tassula Jensen and I am the administrator of the school. We're here to help you. See you soon.
Dear students, welcome to the School of Medicine of European University Cyprus. My name is Alexandros.
And my name is George. We are the lab technicians of the Department of Dentistry.
See you in the labs.
Hello, my name is Christy. Thanks for joining us on this 360 tour of the EUC campus. If you're watching on YouTube, you can interact by moving the cursor around to get a full 360 view, or you can use a VR headset to get the full 360 experience. Take a look at a higher angle too. It's really impressive. Our next stop is the Microsoft Innovation Center. This place is really incredible. It's where entrepreneurs and startups bring their ideas to life. As the only Microsoft Innovation Center in the country, it is no wonder that EUC has ranked amongst the top 100 universities worldwide in innovation. This is the Cultural Center. Important world leaders and great academics have addressed the EUC community through the years, including presidents, prime ministers, Nobel Prize winners, and inventors. Some unforgettable moments on the stage. Welcome to EUC School of Medicine. Come on in and let me show you around one of the most technologically advanced facilities in Europe. Our med students come from all over the world, and the program is fully accredited by WFME and has a great student-teacher ratio. Learning with patient simulators means you're learning with the most modern medical education methodologies. Small classes and close interaction with your professors help you develop clinical skills right at the very beginning of your studies. Equally impressive is our Dentistry Department, the first and only dentistry program in Cyprus. One of its most critical features is a fully functioning dental clinic right on campus. Using the most advanced technology in dentistry education, our students learn with high-end simulators to master their skills. All this is done in very small classes with constant interaction with your professors. Our dental labs are fully equipped with haptic technology that provides high-fidelity simulation and training in augmented virtual reality. This gives dental students the real feel of working on patients as they develop the skills to become fully qualified dentists. Pretty impressive, right? We're now in the section of the building where you will find the labs to our pharmacy, biology, and biomedical sciences programs. Students get hands-on training with state-of-the-art facilities. They're really getting the skills these fields demand. Did you know that EUC is the only university in Cyprus that has 5 stars in employability from QS top universities? This is due in big part to the Career Centre's strong industry links and personalized career counseling. These guys should become your best friends while you're here at EUC. They're going to help you land that dream job. Let me show you around the library. This is a great place to do some work alone, away from all the noise. Students love to sit in these comfy chairs, pop on their headphones, and do some work alone, or to find a room to meet up with classmates and do some group projects. This is a place you really want to get to know right away, the Advising Center. Our friendly team of advisors are ready to provide solutions to your everyday academic needs. These guys are really going to help you make the most out of your student experience and achieve your academic goals. This is what makes EUC so great, the personal attention. Hey, just a 2-minute walk from campus, our student accommodation halls. You'll love the independence and the convenience combined. Living in the halls gives you the full student experience. They're not just a place to live, but a great chance to hang out and meet new people. The halls are built to offer students modern, comfortable, and safe living spaces with just about everything you need at your doorstep. This fully equipped gym and wellness center gives you the chance to find the balance between academics and socializing while keeping your fitness goals. We hope you enjoyed this 360 tour of the EUC campus. We're really looking forward to welcoming you guys in September. If you have any questions or want to talk to an admissions advisor, you can give us a call, drop us a line, or let's chat online. All the things you need will be up in a minute. Thanks a lot, and we hope you have an awesome day.